Intravenous anesthetics. Intravenous anesthetics are mainly used for the rapid induction of anesthesia. They may also be used alone to produce a slight level of necrosis for short surgical procedure. There are some intravenous anesthetics: thiopental sodium, ketamine, diazepam, lorazepam, and midazolam, etomidate, propofol are there. The first intravenous anesthetics of this video is thiopental sodium. It is an ultra-short-acting barbiturate with rapid entry into brain due to high lipid solubility. It is the one of the most widely used intravenous anesthetics. Induction is smooth and the onset is almost immediate, between 10 to 30 seconds. Thiopental is used as 2.5% solution and dose is 4 to 6 ml. Recovery from thiopental is slow and its effect often persists for 6 to 8 hours. As because barbiturate is ultra-short acting and water-soluble potent anesthetic but a weak analgesic, it has high lipid solubility property, which quickly enter the CNS and depress the function of CNS. Often in less than 1 minute, and redistribution occur very rapidly as well as to other body tissue, including skeletal muscle and adipose tissue. All barbiturates can cause apnea, coughing, chest wall spasm, laryngospasm, and bronchospasm. Dose-dependent suppression of CNS activity is 3 to 5 mg per kg according to intravenous route, 2.5% solution, 15 to 20 seconds time. There are some advantages. It is rapid induction property, does not sensitize myocardium to adrenaline, no nausea vomiting properties are there, non-explosive and non-irritant, and it can be used alone in terms of short operation procedure. And some disadvantages are depth of anesthesia difficult to judge. The pharyngeal and laryngeal reflexes persist. Apnea, controlled ventilation, respiratory depression, hypotension is rapid, and shock, hypovolemia, severe collapse, poor analgesic and muscle relaxant properties are there. Some other drugs in intravenous anesthetics are propofol. Propofol is most commonly used parenteral anesthetics. It is insoluble in aqueous solution and is used as 1% emulsion in soybean oil, glycerol, and purified egg phospholipids. The induction dose of propofol in adult is 1.5 to 2.5 milligram per kg. It has onset and duration of anesthesia similar to the thiopental. Some advantages are it has rapid induction property. It does not sensitize myocardium to adrenaline. It has not nausea and vomiting properties. It is not explosive or irritant to airways. It has short operation in OPDs. Some disadvantages are It has induction apnea, hypotension, vasodilation, bradycardia frequently, dose-dependent respiratory depression. Maybe it can rise according to the dose. Some pain during injection as because it is a local anesthetic combination. The another is ketamine. It is a non-barbiturate compound. Ketamine is mainly used as an induction agent for pediatric anesthesia. It can also be administered by intramuscular route. It produces catatonia, amnesia, analgesia with or without actual loss of consciousness. The state of unconsciousness produced by ketamine is quite different from barbiturates. So, it is known as non-barbiturate compound. The patient eyes may remain open and appear awake but does not respond to sensory stimuli. Such a state called dissociative analgesia or dissociative anesthesia. Unlike other intravenous anesthetic, ketamine produce analgesia. Disadvantages are it increases cerebral blood flow and may induce hallucination, involuntary movement. Also, it produces vomiting, salivation, and skin rashes. Some other patients suffer uterine stimulations also. It has poor muscle relaxation property. It is available in 10 to 100 mg per ml preparation and the intravenous dose is 2 mg per kg. For intramuscular injection, it is used in a dose of 10 mg per kg. It is particularly useful in children who resist inhalation anesthesia. It is frequently abused drug because of its psychoactive properties.